All right, so I'm gonna go ahead and verify my orders first. So my order is that I have a patient who has come in with uncontrolled diabetes. What we're going to do is we're going to monitor their blood glucose level, and then we're going to give them 17 units of NPH and 7 units of the regular insulin subcutaneously. And we're gonna do that right now. So I'm going to go ahead. I have got my medication here. I have verified that I'm doing my first med check, so I've got everything here that I need. And then I'm going to go ahead and go in the room. Everything is unopened and nothing is expired. So go ahead and go in. Hi, my name's Lindsay. I'll be your student nurse for today. I'm going to set all my supplies down here first. Okay, I'm going to perform hand hygiene. All right, go ahead and grab my gloves. Okay. So the next thing I'm going to do is provide privacy for the patient. Okay, I'm going to come over here. I've made sure that my trash can's in the place that I would like, and I'm going to pull up their chart. All right, can you verify your name and date of birth for me? Ivy Armstrong, 3/9/1964. Perfect. And any allergies? All right, just latex. Okay, so we're going to go ahead and kind of explain what we're doing today. So we're going to go ahead and check on your blood glucose levels, and then after that, we're going to administer our fast-acting and regular-acting insulin here. So we'll go ahead and get you raised to a comfortable position. All right, are you having any pain? No? Okay. Just lift you up here to a working level height. Okay, here's your head. Perfect. Okay, so we're going to go ahead. Do you mind if I place some items on your bed here? Okay. I'm going to briefly place these here. I'm going to go ahead and wipe down my surface. Wipe everything down. Okay, go ahead and throw those gloves away, and I'm going to perform hand hygiene again. Okay. So now what we're going to do, before administering the insulin, we're going to check your blood glucose to make sure that everything is okay. So I'm going to go ahead and grab everything here. All right. So now what I'm doing is I'm going to organize my tray over here. So I've got my medications along with my syringe over here. I've got a piece of gauze, and then I've got my alcohol prep pad. So what I'm going to do is I'm going to open up the Echo Check, and I'm going to turn on our machine. Okay, we're going to go here. All right, so the first thing I'm going to want to do is I'm going to scan our operator ID. Perfect. I'm going to press Patient Test, and then I'm going to scan the patient ID. All right. Can you verify your name and date of birth for me? Perfect. Okay. All right, so that's correct. We're going to press yes. Now I'm going to scan the strips here. Okay. While I wait for that to load, I'm going to grab my strip. Okay. I'm going to insert the key slot here. Make sure everything looks good. Okay, so now I'm going to go ahead and take an alcohol wipe, and I'm going to wipe down the area. So I'm going to go ahead and pinch a little bit here, make sure I can get good blood flow. Wipe down that area. Let that dry for just a moment. Okay, I'm going to grab this here and twist off the purple cap and pull. You have to get a new one here. Twist off the cap and pull the cap off. Okay. Alright, so now I'm going to grab the area and push down. Perfect. Okay. I'm going to dispose of that into the shark bin over here. Okay. Alright. Alright, so the first drop of blood, I'm just going to take a piece of gauze and I'm going to wipe away the first bit of blood so that way we're not using that. We want the second drop of blood. Alright, there it is. Wipe away the excess. Okay. And I'm going to use my AccuCheck here, and it's going to read the level here. So it looks like we have an out of report range, so it is high. So we're going to go ahead and notify our house supervisor for today. Go ahead and send that through, so they've notified. Press OK, and we're done here. So I'm going to go ahead and throw this away. Go ahead and wipe off the area clean. Okay. Alright, using my gloves, I'm going to go ahead and wipe down the machine and power it off. Okay. Wipe it down. Place it back in the bin. Wipe everything down. And put it off to the side. So we are now done with that area there. Wipe down this desk. Okay. So your blood glucose was a little bit high, so we're going to go ahead and notify our house supervisor, and we're going to go ahead and get ready to inject your insulin. So I'm just going to do hand hygiene again. I'm going to grab my gloves. We're going to mix up our insulin over here. So put this here. So I'm doing my second check while preparing the medication. So I've got my NPH, which I need 17 units of, and I have my regular insulin, which I only need 7 units of. So I'm going to go ahead and open this up here. I'm going to take another alcohol wipe. Okay, I'm going to open up my sterile needle here, my insulin needle. And I'm going to take an alcohol pad. I'm going to scrub the hub of each of these for 30 seconds just because it is communal. So put this here, 28, 29, 30. The second one, 28, 29, 30. Okay, so now that is that. I'm going to place that off to the side. Okay, so when doing insulin and when mixing two separate vials, we're going to first, we're going to go from cloudy to clear. So the orange here is our cloudy and the yellow here is our clear. So we have our NPH and our regular insulin. So First thing I'm going to do is I'm going to draw up 17 units of air. 16, 17. So the black mark is on the line of the 17. So I'm going to uncap my needle and I am going to inject 17 units of air. All right. So I'm going to remove that and I'm now going to draw up 7 units of air. 6, 7, and I'm going to inject that into my regular insulin. 7, and now I'm going to draw up my medication. So I'm making sure it's in the liquid, and I'm drawing up 7 units. I'm flicking out any air bubbles. All right, drop this down. All right. Perfect, I've got 7 units, so now I'm gonna add 17, so we'll have a total of 24 units. So I'm gonna go back into my NPH, which is my cloudy solution, and I'm going to draw up 17 units for a total of 24 units. Flick out any air bubbles. Alright, looks good. And I'm going to go ahead and cap my needle, just because it is unused for right now. So the next thing I'm going to do is I'm going to notify my patient of our third med check. So I'm going to be talking with the patient about the medication that we're going to be giving her today. And then we're going to go ahead and get the area ready. All right. So I'm going to go ahead and clean my area. 1, 2, 3. Okay, 28, 29, 30. And I'm going to let that dry and I'm going to go over the medication. Okay, Ivy, so with this medication here, we're going to go ahead and give you 1 milliliter of our, 24 units of our mixed insulin. So we have 17 units of our NPH and 7 units of our regular insulin. We're going to go ahead and administer this subcutaneously, so at a 45 to 90 degree angle. We are going to administer it right now for your uncontrolled diabetes. So because your blood glucose levels were high, we're going to go ahead and administer that. And that is everything. So can you verify your name and date of birth for me again? Ivy Armstrong, 3/9/1964. Okay, perfect. So we're going to go ahead and get it. Would you like me to count down for you? Sure, okay. All right, so I'm going to go ahead and uncap the needle. The area is clean, so I do not want to touch that. I'm going to grab it like a dart here, and I'm going to administer this slowly. So I'm going to pinch the area just a little bit, go in at a 90 degree angle, then grab the needle. I'm going to administer it slowly. Okay, engage my safety. I'm going to go ahead and put this in the sharp spin over here. Okay. All right. I'm going to dispose of everything else. Are you still feeling okay, Ivy? Yep. Okay. So I'm going to go ahead. I'm going to lower the bed now for you. Is there anything else I can get for you? Okay. Your call light is in your left hand over there. I'm going to go ahead and place you down. I'll be back to check on you in about 2 hours, okay? All the way down here. Okay. Let's take off my gloves. Do hand hygiene one more time. Alright, and I'm just going to wipe down my area before I exit. Alright, Ivy, I'm going to be sure to document everything that we went over today and all of your medications that were given, okay? Alright.